Thank you very much. Rosalini, Mr. President, it's a pleasure and honor for me to speak in this OCA meeting, and I would like to thank you very, very much for inviting me. Next slide, and the next one. So I'm going to talk about the need for home OCT. Home OCT, for the people here who are not ophthalmologists, is our tool for monitoring retina disease. The top picture shows you a normal OCT that shows the retina morphology, histology, and the lower picture shows you an OCT in disease. And you can see hyperreflection and hyperreflection, and this is the way we monitor our patients. I'm going to focus on home OCT, and according to the topic that I was given, to specify on the role of AI for the use of home OCT, the concept of monitoring with home OCT, and the evidence that we have thus far on its performance. Next, please. Next slide. We have a great breakthrough in the last decade in the management of macular degeneration, a disease which was mentioned already a few times in the talks today. So macular degeneration is the main reason for blindness in people 60 years of age or older in the world. And knowing what happens with aging of the population, the prevalence increases. So we do have a new treatment, not so new anymore, for which we can give injections in the eye that contain anti-vascular endothelial growth factor and stop the disease and prevent blindness. However, despite effective treatments that have been proven in multi-centered trials, many trials, plethora of trials, still only about a third of the patients maintain functional vision. And the reason is that the results in real world are totally different than the ones in the pivotal trials. Why? Because this need for frequent injections harbors an unacceptable burden on the physician, patients, and caregivers and the system, and thus bring along huge non-compliance with a very important impact on clinical outcome. Please, a slide, please. Here you see OCT images of two eyes of the same patient. On the left side, you see how the patient came at presentation. On the right side, after 2 months. You can see the annotation and by AI showing where the fluid is in green. And it seems as though it's very similar after 2 months in both eyes. Next, please. And next. However, in the right eye on the top, in between the visits, there was no fluid, and in the left eye, there was fluid all along, which could actually hint that we do need more or a different treatment. Next, please. So the home OCT shows what happens in between visits. Next, please. The images are acquired in between the visits at home. They are automatically quantified by an AI-based algorithm, and the fluid volume is then plotted as a trajectory over time, giving us a very granular information on the temporal fluid dynamics. Next, please. Actually, it brings along personalized medicine. Next. So why is artificial intelligence important and actually critical here? Next. The near-daily remote monitoring is not feasible without AI. The physicians cannot practically review all the home images acquired by the patients. Next. The AI-powered algorithm automatically detects and quantifies the presence of fluid, be it intra or subretinal. Next. Creating a fluid thickness map. Next. And then the AI converts these three-dimensional volume scans to a one-dimensional fluid volume trajectory. So the data collected over time is displayed longitudinally. Next, giving the physician a very easy way to look at it. Next. How do we implement the home OCT? Next. There are very important challenges. Those of patient training, the adherence, and the response to the notification, which are based on the testing. Next. This is the flow. It's not something you buy in the supermarket. The retina specialist prescribed the technology. Next. The patient is referred to a monitoring center, next, which sends the device to the patient and then takes care of the logistic and technical support. Next. The patient task is to perform daily scans. All the images are mounted on the cloud, are analyzed by AI. Next. and the notification is sent to the physician either if there is a certain threshold that was met or if the physician requested it. Next. We have a lot of evidence accumulated over the years. Next. Those of practicality. Is it at all practical to use a home OCT? Is it accurate enough? And what is the value on the patient? Next, let's detail these. So for the ability to use the home OCT, we have many studies. A very important one is the one performed in the United States, including more than 300 patients, that showed that 90% of these elderly patients can actually use the device. Next. For the accuracy, we have many studies. All of them showed a very high correlation between the grading of very expert physicians, like the ones that spoke here, and the technology. And if there is a significant amount of fluid, like the one that you see on the right, more than 10 nanoliters, then it's 100% accuracy. Next. Next, please. For the impact on patient management, we have very little data because only now we have longitudinal studies, but we have a small study on 15 patients in the United States that showed that when the decisions were based on the home OCT next slide, then the interval between injections could be extended from 8 to 15.3 weeks. A very, very good reduction on the burden on the patient and on the physician. Next. Also, it has been shown next slide, please, and the next one, that if the retina specialist looked at the results of the home OCT, sometimes even if the patient was scheduled to be treated according to a certain regimen, at 42% of the time, he didn't even treat him. And in cases he did treat, the treatment was given a week earlier, so in a more timely manner. Next. This is an example of a patient. Next. And next, and next. Thank you. So the physician can actually decide when to do the injection when he gets the threshold. It's just an example. I think you said it at the beginning, that it's actually the physician and the AI need to go hand by hand in order to bring the benefit to our patients. Last slide, please. So we have multiple studies that show the usability of home OCT in AMD patients, and the role of AI is really essential. We cannot do home monitoring without AI. It will reduce the burden on the patients and will bring along better outcomes. Thank you very much.